A very good evening and welcome to RTV News in English with me, William Evans, beginning with the headlines. Survivors of the genocide against the Tutsi in former Butamwa commune say that some local leaders involved in the killings deliberately concealed evidence by hiding bodies of victims. While Rwanda plans to spend more than 127 billion Rwandan francs on industrial parks across the country, a move expected to generate over 1.4 trillion francs in revenue by 2029. Also, Rwanda has been ranked 4th in Africa for access to healthcare, according to the 2026 Numerical Quality of Life Index. I'm William Evans, and this is the news in details. Survivors of the genocide against the Tutsi in former Butamwa commune say that some local leaders involved in the killings deliberately concealed evidence by hiding bodies of victims. 32 years later, more bodies are still being discovered and laid to rest in dignity. We do have details. It was a Solomon ceremony marked by remembrance and by the dignified burial of 114 bodies recently discovered in residence fields during cultivation. Survivors from the former Butamwa commune, now in Majarajere sector of Nyarugenge district, said that the area witnessed extreme brutality during the genocide against the Tutsi. Among those remembered are Tutsi who were tied up and thrown into a Kagera river. Survivors say this reflected a systematic plan aimed at extermination. We all were paraded, and I think it was on the 18th, and they were going to drown us in Akagera. We were almost 100 in number. We were all bundled up with both our legs and hands tied, and they threw one by one in the Akagera. I was lucky enough that when they threw me, the river flowed towards some grass, and that is how I survived. There was a forest that belonged to a man called Mushumba. Here, multiple Tutsi were butchered, but the sad thing is that when we returned from refugee camps, only 8 bodies were recovered from this place. Yet, hundreds of people were killed in this very place, including both men and women and children. Kigali Deputy Mayor in charge of urbanization and infrastructure says remembrance and dignified burial are essential in restoring the dignity victims were denied while helping survivors in the healing process. Genocide crimes have no expiry date. That is why, in this journey of unity and reconciliation, we call upon anyone with information about places where some bodies of victims of the genocide against the Tutsi are to share this information so that we can bury them in dignity. This will enable many families to settle and also speed up their healing process. The 114 bodies buried at Nyanza Genocide Memorial were discovered in January this year in Iburema village, Matabasel, in Majarajere sector. Authorities say searches are still continuing in the area where more bodies are suspected to remain undiscovered. Now, Rwanda plans to spend more than 127 billion Rand francs on industrial parks across the country in a move expected to generate over 1.4 trillion francs in revenue by 2029 while creating tens of thousands of jobs. We do have details. Industrialization remains a key pillar of Rwanda's economic strategy. 4 industrial parks in Muhanga, Bugesera, Rwamagana and Musanze are at the center of this push. In the current 2025-2026 fiscal year alone, the government has already invested around 10 billion francs into these zones. Manufacturers operating in Muhanga and Bugesera along with other clients, said that there has been noticeable progress in the quality of locally produced goods.
Ku isoko rya hano mu Rwanda abakiriya barahari baratuyobotse.
We have clients on Rwandan market that have loved what we produce locally. We also have clients who come from across the region almost thrice a month.
At the moment we are still waiting for the connection to grid, but fortunately I think this month it will be solved. So once we have the electricity, then we will be able to start putting the factory into operation, and I think by the end of the year, after the soft commissioning, then it will be in full operation. So the government has helping us a lot, and I think now when you were entering into the factory you realize that they are expanding the road. It was not easy before, but now it's doing well. As I said before, the electricity is also about to be connected. So, and we are also talking to government to help us with some areas that needs to be recovered from the environmental point of view, and one of them you can see it in the backside. So we try to get access to those areas, and then help work together with the institutions to make a recovery plan and to put those areas into operation. So this is what you see here, and you are very welcome.
This is something very special to us as Rwandan producers, because we used to import almost all things, but now many of our local factories are close and producing high quality products, and this makes access easy and very cheap. By 2029, the industrial parks are expected to create more than 63,000 jobs, with some workers already employed in these facilities.
In my personal development, I have been able to move from one step to another, and also being able to support my family in cases of emergency. I dream of being self-employed in the future.
I work in construction and I've been doing it for some time now, but the more I do it, the more experience and skills I gain. Under Rwanda's second National Strategy for Transformation, NST2, the government plans to invest a total of 127 billion Rwandan francs in these industrial zones by 2029. However, figures show that since 2013, only 27 billion Rwandan francs, about 10% of the required 252 billion, has been dispersed. Economists say that careful planning remains essential. They argue that feasibility studies should guide the development of industrial zones, ensuring alignment with domestic production capacity and long-term market demand.
When you start a factory, you need to make sure that the raw materials will be available. So that's what we call backward integration. And you need to make sure that the market is there and it will be responsive. National market, international market. So we need to provide support also as far as what we call forward integration is concerned. So a company might not be able to do both the integration, but we need as a government to provide incentives to the people who will be providing the backward and the people at the front, the last mile for the product. Another thing we need to improve on is the vertical integration. So any company, any business starting here needs support. So the supporting activities include the manpower, the train, the workforce, and it includes also the logistics, include the roads. So some of the basic infrastructure are there, of course, but we need more support service because, for example, when a company starts a business in Rwanda, we need to provide those services which make sure that he or she can be operative the next after the RDB registration.
The Minister of Trade and Industry says that the government is working closely with the private sector to expand infrastructure within these parks. After we have established primary infrastructure, there were times investors join us in compensating citizens, and this is accounted for in the budget. Due to some challenges arising from not enough funds, I can say that having primary infrastructure in these industrial spaces is not yet at 100% completion. Therefore, we still have work to do in the coming budget. Despite the challenges, Rwanda's industrial sector continues to grow. In 2025, it recorded an 11% expansion, surpassing the 9.5% target set under NSC2. Meanwhile, the Kigali Special Economic Zone in Masoro alone exported goods worth $290 million and employs around 22,000 permanent workers. William Evans, RwandaTV News. Now, to matters security, as the use of private surveillance technology grows in Rwanda, homeowners and business operators say that CCTV cameras are becoming an increasingly effective tool in deterring theft and monitoring suspicious activity. Across different parts of Kigali, traders and residents who have installed security cameras say that the systems allow them to monitor their premises in real time, even when they are away, while also discouraging potential intruders. Technology experts say that the wider adoption of CCTV camera systems is also contributing to broader crime prevention efforts by improving evidence collection and strengthening community vigilance. Rwanda National Police has repeatedly emphasized that security begins with individual responsibility, encouraging citizens with the means to invest in preventive technologies that support personal and property protection. Police spokesperson ACP Boniface Rutikanga says that surveillance cameras should complement, not replace, citizen awareness and routine security precautions. Modern CCTV systems now rely on internet connectivity to transmit live footage and alerts, while some devices designed to blend into household lighting and other fixtures while continuing to capture activity. The technology is increasingly being seen as part of Rwanda's evolving shift towards smarter preventive security. To matters politics, members of Rwanda's Democratic Green Party say that they are encouraged by recent improvements in public service, particularly community-based health insurance, an area in which the party says it has long pushed for reforms. Meeting in Ruhango district, party supporters from the southern province said that previous advocacy by the Green Party contributed to addressing concerns over poor service delivery for Mituelle de Sante subscribers at hospitals and health centers. Party officials say that although the Democratic Green Party did not secure the level of representation it had hoped for in the last presidential and parliamentary elections, it continues to pursue key priorities outlined in its manifesto through civic mobilization and grassroots engagement. Supporters insist that electoral setbacks have not stopped the party from advancing its agenda on social welfare, governance, accountability, technology, and environmental protection. The party's leadership says its current focus is to bring political participation closer to citizens by establishing party committees in villages and sectors across the country. The Democratic Green Party remains one of Rwanda's most visible opposition political formation, often positioning itself around policy and advocacy rather than parliamentary members. Rwanda has been ranked fourth in Africa for access to health care, according to the 2026 Numerical Quality of Life Index. Officials say that the country's community-based health insurance has played a major role in expanding medical services to ordinary citizens. We do have details to this report. For many Rwandans, community-based health insurance, commonly known as Mituelle de Sante, has become the gateway to affordable health care. Residents who have relied on this scheme for years say it has significantly reduced the cost of treatment and made health services more accessible. It's a less than 30 minutes journey to here. Health centers are close to us. All the time you have your insurance, you get medical help cheaply. You can't stay at home ill. You just have to rush to hospital and get all the medical care as quickly as possible. The 2026 Numerical Quality of Life Index ranks Rwanda fourth in Africa for healthcare access behind Namibia, Botswana, and South Africa. The report gives Rwanda a health index score of 122.13, indicating comparatively strong and stable service delivery. Officials at the Ministry of Health said that the findings reflect years of sustained investment in public health.
We have seen that the number of the maternal mortality rate has at least been halved. The number of mothers who are dying while giving birth has really decreased. And we are not yet at the number we want to achieve. But again, when you see the trend, there is hope that we achieve the target we are aiming at. Another indicator maybe is the number of neonates dying before 28 days. That number has really decreased significantly, and we aim at decreasing it furthermore. The same as infant mortality rate and under 5 mortality rate.
The report also points to growing contribution of private investment in healthcare. Patients using private clinics and investors running them say that these facilities are increasingly complementing public hospitals by easing pressure on state services.
Bamaze kusezerera utashye baragukurikirana hakaba igihe baguhamagara bakubaza ati.
After receiving treatment, they usually follow up on us to see how we are healing. I have often met people and they tell me they were born at Plateau. Others show me kids they delivered from here, yet others share testimonies about their healing. I'm also happy for medical professionals that passed here who have also now established their own clinics. Last year alone, Mituel members contributed 31 billion Rwandan francs, accounting for 34% of the total cost of their treatment. But over the past decade, annual healthcare spending on members has risen sharply from 39 billion Rwandan francs to 98 billion, largely due to increasing treatment costs, while member contributions remained largely unchanged until a recent adjustment. Health experts say that government investment has nonetheless produced measurable results.
You could say Rwanda is performing well in terms of universal health coverage, because some of the indicators is to measure health coverage is affordability, which means can people afford healthcare. Another one is accessibility. Can they access it? Do we have health facilities nearby the people? Can they afford to pay for the services? Now that is already covered because more than 90% of the population have health insurance. So they can pay for it. There's no one who will stay home because they can't afford. Number two is that all the health facilities are close to the people. No one would walk more than 10 kilometers, which is worldwide recommended. So if you take away those barriers, you could say we are approaching universal health coverage. Life expectancy has gone up, now close to 70 years from around 40 years, 30 years ago. So there is all indicators to measure and prove that we are close to universal health coverage.
Under Rwanda's second national strategy for transformation, NST2, the government aims to further reduce maternal mortality, lower deaths among children under 5, and cut child stunting to 15%. Achieving those targets will require an estimated $4.2 billion in investment. Let's now turn to Burera District, where residents of Burera District have begun paying for the next year's community-based health insurance, many crediting local savings groups for making the process easier and more affordable. In Gahunga sector, members of a community solidarity group known as Tuzamurane Chidakama are using pooled annual contributions to cover health insurance fees for participating households. Each family receives at least 20,000 francs towards its Mutuelle de Santé payment drawn from collective group profits built through regular member contributions. Beneficiaries say that the model has eased the financial burden of paying insurance premiums, a system they have sustained for the past 9 years. So far, more than 350 households have already been covered, with local leaders expecting that the number to rise as additional members update their social classification details in the national Imibereho system. Burera District authorities say that nearly 800 such community groups are now helping residents finance health insurance. The district ranked second nationwide this year after achieving full subscription under Rwanda's current Mutuelle scheme, and officials are now urging residents to complete payments early for the 2026-2027 cycle. Now to Kigali City. The city of Kigali has warned that motorists The city of Kigali has warned that motorcycle operators could soon face fines for failing to meet basic hygiene standards as authorities move to tighten cleanliness in public transport services. The announcement follows growing complaints from passengers who say that some riders operate in dirty uniforms and provide poorly maintained helmets that are not properly cleaned between customers. Commuters argue that such conditions are inconsistent with Kigali's image as one of Africa's cleanest city. Some motorist operators say that they support the move, adding that hygiene hygiene checks, should be incorporated into routine roadside inspections to improve professionalism across the sector. City spokesperson Emma Claudine Nirenganya says that enforcement measures, including penalties, are being prepared as part of the wider efforts to improve the quality of urban transport services and protect public health. Kigali authorities insist that cleanliness must be reflected not only in the city's streets, but also in the appearance of operators and the conditions of safety gears used by passengers. The initiative forms part of the capital's broader security and hygiene campaign aimed at keeping Kigali clean, safe and orderly. Now let's turn to Rusizi district, where Rwanda's annual Race to Remember cycling competition is underway as part of the 32nd commemoration of the 1994 genocide against the Tutsi. The two-day event opened with a 119-kilometer stage from Karongi district to Kamembe in Rusizi, bringing together elite male, female and under-23 riders from across the country. Sengyumva Shem of Java Innovo Pro team claimed victory in the men's category, while Ingabire Diane finished first among the women. Riders say that the race offers more than competition, serving as a platform to remember victims of the genocide and honor athletes who were killed. The Rwanda Cycling Federation says that the event was launched in 2016 to preserve memory through sport and to reconnect communities through a shared national message of resilience. For the first time, the race is being held outside Kigali, a move Rusizi district authorities said that reflects efforts to extend commemoration activities across the country during the 100 days of remembrance. 78 cyclists are taking part in this year's edition, which concludes with a memorial visit and a final circuit race through Kamembe. Now that report brings us to the end of tonight's bulletin. I'm William Evans, and from me and the rest of the team, have a good night and goodbye.